Hello, everyone, and thank you for joining me on this very special interview with Dr. Michael Kaye from the Center for Functional Health in Sellersville, Pennsylvania. Michael, thanks for joining me today.
Thank you. It's an honor to be here. How are you today?
I'm doing super awesome, and I'm really excited to dive into this interview with you, learn a lot more about you, get into your story, get into what got you so excited about functional medicine, and learn more about how you help your clients feel their absolute best. We've known each other for several years now, and it's always great to connect and to help you spread the message because you're doing such great work.
Thank you.
Well, first and foremost, why don't we let everyone know a little bit more about you? So how did you get into chiropractic and then functional medicine?
So I was really, really fortunate that I chose chiropractic in the ninth grade. By the end of ninth grade, I already chose Los Angeles College of Chiropractic. And I called them every year until they finally accepted me. So it was really great to know where I was going at that point in time. And it really stemmed out of the fact that I was very overweight, and being overweight and wearing black frame glasses, being the nerd in junior high wasn't the greatest thing back then, where nerds are cool now. So living through that, really changed the way I thought. Being overweight changed the way I thought. Being picked on, being bullied, the way, really changed the way I thought. So the transition happened, ninth grade, 10th grade. I got involved in weightlifting, and I saw there was Franco Columbu. So do you remember Arnold Schwarzenegger, of course? And his friend was Franco Columbu, and he was this chiropractor. I thought this was interesting because I didn't know what it was. Everybody went to the doctor in the neighborhood, but nobody went to the chiropractor. So I thought it was absolutely amazing. So here was this man who was a chiropractor. We were about the same height, and he was working out, and he was really, really strong, and that just changed my world. And then, so it was ninth grade where I said, this is what I want to do. So I didn't want to be in a position where I wanted to be a medical doctor. It was never my choice. My choice was, wow, isn't it fantastic that I can help somebody with my hands, with nutrition, with exercise, and have them feel better and live an optimum healthy life? Because the contrary to that was the way I grew up. So my parents, a sister, diabetes, history of stroke, heart disease, hypertension, autoimmunity. So seeing all of that, I know there has to be a better way. And of course, as you all know, family doesn't always want to listen to you, right? They're like the last people that want to listen to you. And I remember saying to my dad and mom, listen, we can't be eating tasty cakes, the Philadelphia tasty cakes. We can't be eating soft pretzels. Our food pyramid was quite different. It was tasty cakes and soft pretzels and pizza and hoagies and Goldenberg's peanut chews, which was a wonderful gastronomical experience. However, it was detriment to the body. And when I said to my mom and dad, listen, we can't be eating white bread anymore and hot dogs and hamburgers, my dad thought I had that quote unquote eating disease and said, listen, you got to eat something. But they just didn't get it back then. They didn't have the term pre-diabetes, and they were already diabetic. So seeing all of that and seeing how I grew up really propelled me into this kind of health where, we can be healthy. We don't always have to be working on being sick. It's not normal to be sick. It's not normal to run to the doctors. So that was my fuel. That was my catalyst. And now I'm here today.
I love it. And I can certainly tell, I can look at you and I can tell that you take really good care of yourself and that your health and vitality is extremely important to you. And of course, it's important not just for yourself, but you invest a lot in your community as well by being a beacon of light for people and the voice of reason. I would imagine when people are uncertain about what to do with their health, that you're the person that they turn to because of your sound judgment and because of the approach that you take. I would imagine that most people these days, at least the ones that are somewhat awake, are looking for vitality instead of waiting to develop some sort of obscure condition and then have to seek out, conventional medicine and then eventually alternative or even functional medicine.
Very much the patients say they want to feel better. They do say that, but a lot of them say, I want to get better, right? So there's I don't want to feel the symptoms I have now. I want to go to the next level where, okay, I don't have the symptoms and I feel I get my energy back. I feel I get my gut back. I feel that I don't have joint pain anymore, that I think clearer. So there's definitely this shift, especially as functional medicine continues to just grow with people wanting to feel better. I think they're tired of just getting the medicine for this complaint, the medicine for that complaint. So it's wonderful to work when people say, listen, how do I get to the next level? So I really enjoy that. And the patient benefits greatly from that as well.
Yeah, and it sounds like you really have to pay attention to the words that people use, because that can be deterministic in the effort that they're willing to put forward. So somebody who's saying something like, "Oh, I just want to feel better," that person may not be willing to do the work that's required for them to actually get better, right? Because we don't just magically get healthy, as Arnold Schwarzenegger would say, kind of staying in line with Franco Columbo and the whole Arnold Schwarzenegger theme here. You don't fall to the top of the mountain. You've got to climb there. And the view and the accomplishment is certainly worth it, but it is an effort, right? And if people aren't willing to put in that effort, then they can never truly experience true health. So with that being said, what are some words or phrases that people use that raise red flags for you, in the sense that, you know, it might cause you to pause and get them to shift their way of thinking, because some of this thinking pattern could be unconscious, or it might cause you to, you know, reframe their paradigm so that they can get better outcomes? What are some of those phrases or words?
You know, it's interesting in the musculoskeletal world, when we have the patient that comes into the office, they have the neck pain, and I say, do you get headaches? And they say to me, only the normal headaches. And there's no such thing as a normal headache. Of course, we all get headaches once in a while, but it happens so often they think it's normal. So a lot of times the complaint that comes back, yes, it becomes their normal, but that's not normal. And then I'll ask them to describe their headaches. And it's interesting because those who will say, well, it's kind of like pinching, it's achy, it's throbby. And then there are those who say, it's crushing. It feels like my head's going to explode. And these are very emotional descriptions of their headache. So I know I have to move that thought process more into what's happening underneath, right? So as they say, you might have heard, you need a checkup from the neck up, right? So you have to figure out what's really driving the headache. And when it comes to a lot of the gut people that I see, you know, when they say to me stuff like, you know what, I feel it at the end of my workday. I feel it when I get together with my family. I feel it when. So looking at their terminology and words that they use and phrases, and when their symptoms are happening, I kind of put all that together. So I watch for that and say, okay, yes, you can take this probiotic, and we'll talk about probiotics in a bit, but you know what, maybe we need to really dial down and say, you know what, this is how we're going to reframe and think. We're going to meditate before we go into the room with all our family members that drive you crazy. And we try to look for those lifestyle changes that we can do. Listen, you can take all the vitamins and supplements, as you well know, but unless we address the lifestyle, it really doesn't matter.
Yeah, lifestyle is so huge, and it's the rock that people tend to turn over last because of probably wishful thinking. I mean, I wish, and I'm sure you wish, there was a magic pill that we could take and didn't have to do all the other things to maintain our health and to optimize our health. I mean, I actually enjoy doing those things, so I wouldn't wish for a magic pill to take all of those joys away from me. But I bet a lot of people do feel like that. They feel overwhelmed. They feel crushed by pressure from work. They might feel crushed from financial pressure because, you know, they don't have a proper game plan in place for whatever reason. They could be crushed by social pressure, right? Because they don't have good boundaries. They could be crushed by a whole slew of things that are causing them to be in this hyper vigilant, stressed out state, which obviously impairs their healing and repair. So, you know, aside from, you know, people with digestive concerns, what are some other kind of red flags that kind of jump out at you?
Well, when the person comes in and they're talking and they share about what they're going through in life, and we know that a lot of their complaints, their symptoms, is really driven by stress. Where they come in, I have chest pain, I have pain going down my arms, my gut is bothering me, my joints ache me. And you speak to them, you find out, you know what, stress is an underlying factor. And now we got to get that buy-in to get them to actually understand that stress is a driving factor. Because they'll say everybody has stress, but I personally feel the longer you are sick, the harder it is for you to handle the daily stressors in life. So when I find out that they're having a tremendous amount of problems either at work or at home, and you kind of got to dig deep, and that's what we like to do. You know, we like to dig deep to find out really what that root cause is and what's going on. And then I can put together a better game plan. And that better game plan, again, back to lifestyle, might be something like, you know what, you're going to take up yoga. You're going to take up meditation. I can't do meditation. I tried and it doesn't work. How many times have you heard that? Right?
Often. Hmm.
Often, right? So, and I just got to get the buy-in. Can you meditate for 5 minutes? Can you meditate for 10 minutes? Can I teach you box breathing? So it seems like these little things are just little things, but these little things have great return. So when we look at somebody with that irritable bowel syndrome, if we don't address stress or if we don't address exercise, we're missing large components. And that exercise for that person can be too much exercise as well. So sometimes their exercise could be causing them their stress. And we see that quite often. So we want to find out what's going on. Again, create that game plan so they can change the lifestyle and something easy for them to do. And then we move forward. We just need a little bit of a buy-in. They feel great. We move forward.
Awesome. So I just want to kind of paraphrase what you're saying. It starts by really carefully listening, the words that they're choosing, the context in which they're choosing the words, how they're describing what they're experiencing, and the mindset around what they're experiencing is very, very critical. So you're going to have somebody come in, you're going to really deeply listen to what they have to say, and then you've got to get them to create the mindset shift that's necessary. You've got to get them to buy into the fact that they're responsible for their, the majority of their health and healing. And then you're going to then take them under your wings. What are the next steps after that? So once somebody says, yes, Dr. Michael, I'm all in, what are the next steps that they can expect from you?
So one of the things we like to do is after a complete clinical examination, is I like to look at some testing. So we'll look at the traditional blood testing that they would normally get in a doctor's office. Sometimes I will do a lot more because they'll just hit the basics. They'll just hit a lot of times what the insurance covers. And we want to go deeper. And then I'll add in some functional medicine testing, whether it be a GI map test, looking at digestive, looking at organic acid tests. And then when I can get all of this information together, I actually have a game plan. And that's when we sit, and I like to say, we like to sit knee to knee. Our first exam is about an hour and a half with somebody. And people are so used to, 2 minutes, 5 minutes, 7 minutes. So to actually sit with somebody and learn their story is really important. And then we put together the game plan. And here's where we want to be careful because there are so many things that need to be changed, but we don't want to change everything at once. And the reason why is because the patient will have a pushback. So we pick the thing that's easiest for them to change. Maybe we'll work on sleep. Maybe we'll increase water. Maybe we'll start walking. Maybe we'll start doing only 10 minutes meditation because if I say 15 minutes meditation, maybe that may seem too much then. So when we look at that as an individual, we look at their whole lifestyle and we say, okay, this is the easiest thing we're going to do this week. What's great about the program being a length of 6 months is that I get to speak with a patient every single week and we know the changes that are going on and we can make the subtle changes as well. Also decreases a lot of their stress because a lot of them are afraid that I'm going to go to the doctor again. They're going to give me another medicine or they'll send me for another test, but I won't know what's going on. It'll just keep going and going and going. So we want to put a stop to that, look for the root cause and build that person back up again.
I love it. So you're working with somebody over a 6-month period because that gives everyone a realistic timeline to work with. I think that the body can heal very rapidly, but for that deep healing to take place, for the shifts to take place, and for things to stick, it's going to take a little bit more time than just a couple of days or even just a couple of weeks. So I love how you nurture them and support them throughout that entire journey because, this is something that is missing, I feel, in healthcare is that accountability, that coaching, that mentorship that I believe patients need in order for them to, take these simple things, put them into place, and then get that reinforcement that they're doing things correctly. Now, you did mention 3 tests. You mentioned conventional labs, which I'd love to know what you order in addition to traditional labs. So somebody who's been to see their traditional family doctor, what are the labs that are missing? I want to go into that. And I want to talk about the GI map, which is a stool test that you use, and the organic acids a little bit more. So let's start with some of the non-conventional, conventional labs that you order.
Yeah, so they normally run the complete blood count and then basal metabolic panel. Once in a while, we'll get lucky and they'll throw in the thyroid, but they won't do a complete thyroid panel. So they'll throw in the TSH, thyroid stimulating hormone. They will do what's marked off as a thyroid cascade profile. But if the TSH is within its reference range of their reference range, they won't run the other thyroid. So we like to look at the T3, T4, free T3, free T4, TPO, TPA. So all that's really important. So there's about 11 markers I like to take a look at. if I'm concerned about the thyroid. We look at vitamin D. It seems like that's not even covered anymore. For a while, the insurances were covering it. Now docs aren't doing that in my area anymore. So we'll look at vitamin D. We'll look at red blood cell magnesium as well. God bless you. So these are the other kinds of blood work that we will take a look at. I usually run an iron panel. I'll usually run inflammatory markers as well. And again, our local docs are like, well, you don't need that. And my feeling is, well, I do need that. The patient needs that. And if everything's normal, then we're great. Now, when we talk about normal with respect to blood work, because I always run a hemoglobin A1C and glucose and all that, because I want to make sure that there's no prediabetes. What is considered normal within a reference range, it's their reference range as given by the lab. But I like to look at the blood work from a pattern perspective. So if I'm picking up that, something is low here, something is high here, if we're looking at liver enzymes, if we're looking at the hemoglobin A1C, then there's something going on. It may be within a reference range, but it's bordering low, or it's trending low, or something's trending high. At least if I can get that initially, and I need to repeat the study again in 2 months, I can see how that person is trending. So that's really, really important when it comes to blood work. Next thing we look at is the GI map test. So the GI map test has been very helpful for me, especially with my patients who have the presentation of the gut issues, the gastrointestinal issues. So GI map is great because it allows me to see if there's any underlying bacterial pathogens, parasitic pathogens, viral pathogens. It lets me see if there's any H. pylori, any H. pylori virulence factors. It lets me look at what's considered the normal bacterial flora, if there's any overgrowth or anything like that. And what's really important about that test, it lets me know if there's any yeast, any fungi, any parasites, any ova. And real important, how well is this person breaking down fat? How well are they breaking down their carbohydrates? What does their beta-glucuronidase look like? What does their calprotectin look like? These markers that are important for the system to operate well and optimum. So I really enjoy that. And the organic acid tests, I think, are great because it allows me to look at what's like urine metabolites. So I figure out, again, looking at the systems of the body to figure out what the root cause of the dysfunction is and looking at patterns as opposed to you have this that's low or high, therefore you have this disease. And we're not looking at it from that perspective. We're looking at it from the whole person perspective. So I find the test to be extremely helpful. And when it comes to the gut issues, especially irritable bowel, we also do IBS Smart. Are you familiar with the IBS Smart test from Dr. Mark Pimentel? So
yes.
that test has been really, really interesting to look to see if there's 2 antibodies that are present, the cytolethal descending toxin B and vinculin. And if these are present, then Dr. Mark Pimentel's thought process is one point in time, this person had food poisoning, and now we have to address it. So aside from just regular blood work, using the other special functional medicine testing really gives me a good idea of what's happening with a person on an individuality basis.
But what happens when people get these results back? They must be blown away. They must ask you certain questions. I'm sure the question that comes up often is, why didn't my doctor tell me this? Or why didn't my doctor ever order this? What are some common responses that you hear?
So I'm kind of lucky in the sense I've been practicing in my area for a while. So when the patients bring these tests up to the local medical doctor, like, I don't know what Dr. Kaye does. Just whatever he tells you to do is fine with me because I don't know this test. So I'm lucky, we've practiced him for 31 years to the point where like, I don't know what he does, but go see him anyway. So that's great. I really like that. I think they really enjoy the fact that I do a complete write-up. And then I sit with the person again, knee to knee, and I go through, this is what we have on the findings, right? These are our findings, and here are our goals. And here are my thought processes, because I always feel it's important to share my thought processes as their doctor to let them know what I'm thinking and why I'm thinking that. So yes, here's your blood work, but I want to educate them. I want to make sure that they have a good idea of what's going on. I want them to be prepared for when their mother, father, brother, husband, wife, whatever, friend says, why did you do that test? They can go, here's why I did the test. Here's what Dr. Kaye found. And here's his game plan. And then again, we move forward.
Okay, I love it. So I know we talked a bit about digestion. Is that the ideal person that you like to work with in your practice? Is there a specific condition or a set of symptoms that you feel you get amazing results with?
So again, a lot of the GI work and a lot of autoimmune as well. So it's interesting how they kind of overlap one another too. So I find that interesting from a biophysiological and biopsychological perspective as well. So again, we see a lot of the gut people. We see a lot of people want to lose weight as well. There's people who have what we call stubborn weight loss, and they're looking for a way where they can lose weight. They've been to the other places, they've had the other diet systems, and maybe they lost 10, 15, 20 pounds on the system, but then it comes right back. And there seems to be a gaping hole where they're just not educated on how to take care of themselves. And that's what I want somebody to take away, that when they leave my office, I want them to have the tools that they know how to take care of themselves. That's really important. Not to go onto Dr. Google, not to run to the internet. Not that the internet is bad, it's just, it can't look at you as an individual. So when people say to me, what diet should I be on? I'm like, I don't know. What's your problem, right? It depends on your goals, your gut, your GI system, and your genetics. And so we like to look at that person from an individual basis.
Now, since you brought up genetics, is that something that you test for in clients?
Not yet, and we're getting closer to that. We had at Practice Perfect Live that Mansoor that came in. I absolutely loved his work. So that's our next level where we were going to. So I know I have him and then all of you guys there when I go genetics.
Okay, awesome. And for somebody who's who's kind of sitting at home listening to this interview, wondering, how do I connect with Dr. Kaye's office? How do I learn more about what they're doing? Where would you want us to send them?
So they can go right to our website, the centerforfunctionalhealth.com, and we have a discovery call. And they just click on the discovery call, they set up an appointment, and then I get on the phone with them and we chat for a while and we decide if we're a right fit. And that's how we move forward. It's actually that easy.
So what would you say to somebody who's wondering if they're the right fit? How can I identify, if I'm a listener to this, if I'm the right fit or not? What are the characteristics that you look for in a client?
So I look for somebody who's willing to do the work. Again, as you said earlier, you're not falling, you're not falling up the mountain, right? You have to climb a little bit. So this does take some work. This takes lifestyle change. So I'm looking for that, somebody who's really willing to do the work. I'm also looking for somebody who's has a support team at home. And we've had that happen before where a patient comes in, they're really into what we're doing, they want to get better, they want to feel better, they want to move to the next level, but they can't get the support at home. That's why when I'm speaking to one person, if they're married, I want to speak to the other person. And I want them to know, what, we're moving as a team. It's just not me and the patients, me, the patient, everybody at home, including the kids as well, because the kids will strongly benefit. I know my children strongly benefit from me being into health and nutrition. They may mock me and have fun with me, but they really know what they are eating, what they're doing, how they're living, and lifestyle plays an important role. So we look for that patient who wants to really do the work.
I'd love to hear some of your success stories. Is there a particular client that kind of jumps out at you whose story you'd like to share?
Yeah, so one patient, female patient, she's about 57 years old, and she had a lot of irritable bowel syndrome, had endoscopy, had colonoscopy, had been put on Bentyl, had also put on Imodium, which is loperamide. Went to a health doctor, is what she called the individual, and then the health doctor put her on ox bile, and then she had pancreatic stones. And she was like, I am never taking any of this stuff ever again. She came to one of our workshops, because we do workshops at least once a month, once every 6 weeks. Listen to what I had to say. And then it was about 3 or 4 weeks after that, she called me and she said, you know what? I want to be done with the other stuff. I need to move forward. And we had a conversation. She came to the office. We did a complete exam. We did a GI map test. Now, the GI map test showed overgrowth in bacteria. She had a little bit H. pylori, but I really wasn't overtly concerned with that. However, her pancreatic elastase was, I think, 150, and it should be at least 500. So I know she wasn't breaking down her food properly. So we got her onto plant enzymes, and we changed her diet around to follow more of like a autoimmune paleo diet. And it had to be probably within 4 weeks, the complaint of the diarrhea, the complaint of the brain fog, of constipation that she would get when she was on the Imodium, because she'd go one way where she's going all the time, take the Imodium, and go the other way, kind of just slowly all went away. So now she's been with us, I think, 7 months now, and there's no more medications, which is absolutely phenomenal. when it comes to supplements, she takes a probiotic and she takes her enzymes. And then I gave her SBI Protect to help her gut. And that's it. And she's feeling great. And she really finally gets to that. You know what? It's what I'm putting into my mouth. It's what I'm eating that is driving my condition. Now she knows what she can eat. So that stands out a lot.
A lot, so empowering, and somebody who was almost at the brink of giving up hope, but they find the right person, the right strategy. They buy into the process, and certainly they stick with it, and they see a result. I mean, it sounds like a very simple formula, and more people should be reaching out to you because of, I know, the love and the compassion you put into the work that you do, the high level of integrity that you put into the work that you do, and you're constantly sharpening your skill set and your sword so that you can help more and more people. So thank you so much, Michael, for being here. Thanks for sharing your amazing insights, and thank you for being, again, a beacon of light in your community, not just locally, but also online. You share some fantastic information. And I love the fact that more and more people are going to get to hear about the amazing work that you're doing. I wish you amazing success. Is there anything that you want to tell the listeners before we
Nope.
tune out?
I thank you very much for today, and I appreciate all of your guidance as well. So thank you.
You're very welcome.